Welcome to the Sultans of Sales podcast. I'm your host, Jameel Pendleton. My friends call me Jay. We have such a special guest on the show today. Kelli Ashkouti Sullivan comes to us from Atlanta, Georgia. She's been in healthcare med tech for a long, long time. We was just talking about her career path offline here. And Kelli's got well over 20 years of experience doing multiple different things. And I'd love, Kelli, for you to kind of talk a little bit more in depth, but we'll just give the audience a little bit of a background of you. You spent 7 years at Glaxo. Before that, a little bit of nursing and home health, almost 10 years at BD, doing a variety of different things, running teams, sales enablement, sales representative, right? Carrying a bag, leading a team, doing various leadership positions for these companies. And now you're swimming deep in the startup role as senior director of sales for Proximie, one of the most exciting companies I've seen come about in quite some time. So Kelli, thank you so much for carving out some time with us. Welcome to the show.
Thank you. Thanks for having me. This is really exciting.
Yeah, you bet. So I think let's start with your path and I always like to hear about where people got started, and I kind of gave the audience a little bit of a rundown of things and in companies and places that you've been, but what's kind of your story? Like, how do you explain where you got here today?
Yeah, no, thank you. I think I wanted to be a doctor, and that obviously did not work out the way that I had intended. Right. But medicine and healthcare and patient outcomes were always something that really drove my purpose and where I wanted to be. And after realizing that I wasn't going to go to med school, I went to my mentor, who was a craniofacial surgeon, still is at Shoah in Atlanta, and said, nice. What am I supposed to do? Right? Like, right. Where do I go? And he's like, go into sales, go into med device, dive in and make sure that it, lands where you want it to, as far as the devices that you sell. And that's kind of where I came from. And then I went into beer sales. Like a lot of us who didn't have the sales and had all that medical background, but no real higher level degree in medicine. And then after about a couple of years of that, I knew I needed to then break into the industry if they'd have me, and was really lucky to break in with GlaxoSmithKline.
That's awesome.
Yeah. And
I don't want to interject, but the fact that you went out and got sales experience, it doesn't matter where. I was at IBM. I spent 4 years of B2B sales. There's many different routes you can take just to understand the selling process, how to manage the territory, how to talk to customers, right? All the things that you probably learned. It doesn't matter if it was beer sales, real estate, B2B, copiers, whatever it is, uniforms, right? It's just it's a box check that a lot of people are dismissing these days, and yet still trying to break in. From a company's perspective, having been on that side of the fence, it's risk mitigation, for the company to know that you can sell before, they give you that opportunity.
I would agree with that. I just did a really awesome, fun podcast with Medical Sales College, and it was that same thing. These guys are investing in another certificate to help them get into our industry. And I think that what was unique, kind of to your point, is you don't have to have pharmaceuticals or med device. Like, what else have you done? What else has rounded you out as a salesperson? Or maybe you were just waiting tables, right? That's how it starts. It's that interaction with another person. How do you connect? How do you find that piece that makes them, figure out what they need next?
That's right. And I feel so strongly that everybody's unique, everybody's different. And for those companies that are looking for talent, there's not one shape or look or feel, right? It's just about the person and the fit, right? The opportunity of the person. Well, that's awesome. Well, so let's talk a little bit more about kind of your career path, because from my standpoint, having just started out as in a startup environment, I have a lot to learn from you, over 9 months now in the startup world. So wherever you want to take that, kind of what you're doing today versus what you did and kind of what you've learned, or kind of, I don't know. I'm interested in people that go from the big strategic companies into the blue ocean of startup world.
No. I mean, I think you have to get wildly comfortable being uncomfortable. And when I have interviewed for several positions to bring new talent into Proximy, I think I might scare them a little bit and say, look, if you are not comfortable being nimble and pivoting quickly, this is not the place for you. I think startup is such an incredible opportunity where, as you know, when you're in a big company, it's got this beautiful sophistication that it teaches you really how to navigate through any situation from a high level. However, there's so much red tape, and you can put something that you think is an incredible idea, but it might take years or months or however long to make that happen in startup. It's such this awesome opportunity to not only be the architect of your own career, but you're also the architect of like, what's next in that company. And it happens fast. And I think it was maybe our CFO, Jesse, who said, you know, you can fail fast because you have to make sure that whatever next step you're doing is better than the one you did before.
That's so great. I love that. There's so much to take from that. It feels like that you found your passion or your calling. Would you agree?
Yeah, absolutely. And it's really cool. You know, I'd say at 40, you don't really think that like you're going to just totally change everything and recreate. And I think that my brain has turned on in a way that I never thought it could again. And it's every day is kind of humbling here, and it's exciting. And I don't know. I found my passion for sure.
It's so great. And I can see it. I mean, I can physically see it. I know we're on a Zoom call, but I mean, hey, it's almost 2022. This is kind of part of it now. I can see it and hear it in your voice that, and we've talked before, right? And we met early on in your path with Proximy, right? And I think actually we connected because we're both I'm 41, right? But we're both Lebanese. And so I wanted to talk about that because it's tough. Everybody that I meet that's Lebanese, I feel as if they're my cousin. And,
absolutely.
It's like, we are. It doesn't matter if we're not blood relatives. Like we live a very similar, we have grown up in a very similar environment. So let's talk about that, like culture or family or whatever in your life, Kelli. Like what does that look like?
I mean, I think, you know, it gets back to why Proximy as well. I mean, Nadine, our CEO, is Lebanese. And
yes, she is.
Following somebody who's so, I don't know, magnetic, and that she was Lebanese too. There was like this instant familiar feeling. And I think she makes everybody feel that way. But there was a connection to that. And I think that both you and I have talked, our families mean everything, right? That's my driver. That's my purpose. And I think that when you have somebody who is running a company who has similar values and similar feelings that way, I don't know, it just makes you want to lean in for sure.
It does. And I mean, just being around family in work family is important too. So what I feel, the high performing teams out there, if you were to look at a bunch of them, I would say that an overriding common denominator is the feel that there is that familial bond or a camaraderie that exists, whether it's a fraternity or a sports team or a sisterhood. What are your thoughts on that? Like as it relates to what you're doing today?
I mean, I think it's so important, you know, right now, it's like this whole thing around the Great Resignation, right?
I know.
And it's wild, but COVID really, I think, taught a lot of us that value that you speak of right there, and the culture, teams, togetherness, purpose. I think that's very, very real. It's something that can't be ignored. And people don't leave companies because of the company. They leave because of leadership. Right. They leave because 100%. Of bad managers. And so if you don't instill that foundation in a company and the teams, it doesn't really matter if you're selling gold or ice.
Yeah.
You know, it just doesn't land the same.
No, it's so true. And I want to, one thing I wanted to, that you touched on there that I want to build on a little bit is the manager. There are absolute like financial backed data that shows the impact of a bad manager, a failed manager. And it resonates for a long, long period of time. However, there's not really a lot of focused sales manager training, people manager training out there. What are your thoughts on that? Like, why is that? Because there's tons of sales training, tons of anatomy training, right? But then these high performing sales reps, like you and I were, get put into these management roles. And it's kind of like, okay, go lead them.
Right.
Let's talk about that.
That's really interesting. And bringing it a little bit back to Proximie is we felt the same way when Proximie first started. It was surgeon to surgeon, but more, you know, how do we train new medical students or fellows but we never thought about expert to expert.
Yes.
So like, how do people like you, like yourself, it's that same sort of thing. Because you get to a certain level and it's like, oh, they're good. We're just going to train everybody underneath them. And I do think that there's just not enough emphasis on training managers. Agreed. And I think that sometimes you get to such a high level and then you have a coach and then you have all these wonderful things. But I think that I don't even like to say middle management, but we just don't put enough emphasis on it. And I don't know. I don't know what the answer is. I just think that we should do a better job. Hopefully, you know, as the months and years come and as we pivot from what we are seeing right now, that companies will lean more into their management.
Well, I mean, you mentioned medical sales college, and that certainly wasn't around when I was trying to break in. Maybe there needs to be a medical managers college. You and I can lead it, right? Let's go.
There you go.
Business idea. Okay, let's get back to the questions that I actually sent you ahead of time. I'm sorry, I get a little bit off path. Okay, number 2, you were sitting in a time machine, right? A DeLorean, if you will, and
flux capacitor is full. We're good.
Flux capacitor, plutonium, right? Trash, whatever it is. You're good. Do you go back in time or do you go explore the future?
Future, for sure.
Why?
The past is amazing, right? It teaches you things. And I think that without our past, we wouldn't be exactly who we are now, but it's in the past. So if we live there, we're just not focusing on present or future. And for me, again, it may be Proximie, maybe it's just like this new ignited futuristic piece of Kelli, but yeah, absolutely. Let's go.
Future Kelli.
Of course. Yeah.
But what's fun about Proximie from my vantage point is future Kelli is present Kelli, because every day is a new day, a new challenge, right? Whether it's the startup or whether it's the mission that Nadine has, that Proximie has, right? To get healthcare and good care across the globe, regardless of the situation, socioeconomic status. And it's amazing. So that's really, really neat. I like that answer. Like, I don't even know what I think future would be for me as well, but it'd be fun to go back knowing what we know now, right? And avoiding some of those.
How would you do that though? Would it be like betting on a team, or would it be like talking to yourself? Would you if you're going to go backwards, what are you going to do? Yeah,
it'd be interesting. I guess, so the question would be, would you go back and would your, like in Back to the Future, for example, your former self is still there. And so do you give them advice? Or do you I don't know. We could spend the whole podcast on this.
It's a really cool question.
Thank you. I came up with it in preparation for my conversation with Kevin Foley, because he's he's developed so many incredible devices for the spine space that I've used, that I've personally sold. And, you know, I can't wait we've had some scheduling conflicts. Can't wait to get with him, but I figured that might be kind of one of my questions and, for going forward. Okay. 3 words to describe your job today.
Um, there's so many. Inspiring.
Love it.
Disruptive.
Oh yeah.
Ever changing.
That's perfect. I mean, I think that people out there that are either entrepreneurs or in a startup, and they're when they watch this, they're gonna be nodding their heads, because I mean, I'm like very early in this journey, and yeah, I can already see those three words as being absolutely something, and it's also humbling too. So it's
big time.
It's really it's been a really interesting pivot, I would say, for me. What made you decide to do this? Like, what was the kind of the moment, the aha moment in your career? Because you probably had a lot of different options.
I think the aha moment was, again, meeting Nadine. You know, I watched the TED Talk.
So did I.
And I mean, right. And I was like, wow. And then I got to meet her in person. I was like, oh, it's like meeting a celebrity.
Right.
And, you know, she walked me through this. It was months of time. I mean, I knew it was instantly, but it's hard, right? You and I have been in this. I was in big corporate for almost 20 years. And to leave that is really, really difficult. But I think it was her mission, and it was her purpose to, you know, these borderless OR, if you will. That's like, just to coin that phrase. And what she was doing, and she's leaving this world a better place when she got here. And like,
I love that.
And to be part of any of that was just like, all right, I'm in, man. Like, get me a ticket on that.
It's great. And it's bold. And I think that, I mean, I knew instantly when I spoke to our CEO.
Yeah. What was yours? I mean, you have the same thing.
Yeah. I mean, I had a conversation with our CEO, who's a serial entrepreneur. He's had 3 previous startups that have helped millions of people's lives, right, through acquisition, through a couple former companies that I worked for, right, and big things in the medtech world. And I mean, the guy probably could have stopped after his first one, but he just is so, he sees situations that need innovation, and then he builds these teams, and then they get acquired, and then he rinses and repeats. And so I thought, wow, this guy's 3 for 3. So it's not his first rodeo. What an awesome mentor, right? My new boss is this person who's really just helping you just create and innovate and improve, right? Patient care, surgeon outcomes, right? These are really, really big things for me, and they always have been in my career. And so when I thought about this versus the field versus other options, it was just, I couldn't stop thinking about it.
The foregone conclusion, right?
Yeah.
You couldn't help but be inspired.
It was inspiring. It was just one of those things. Like, for me, I mean, okay, like, I was certainly praying about it. I was certainly, you know, talking to a lot of different individuals and teams and companies that I respect and admire. But, you know, for me, this just made the most sense. Right. So
absolutely.
Yeah. Okay. So this one's the big one. And again, this could be the whole podcast. Women in leadership. Women in leadership. I mean, there's been countless articles about this. It's a catchy subject line. It's a buzzword. It's a hashtag. But you've lived this, Kelli, your whole career, been a star performer, a leader. So let's talk about women in leadership. What does it mean to you? You've lived it. What have you learned? Let's just park there for a little bit.
Yeah, no. First, thanks for even like broaching the subject, right? It can be like sometimes polarizing.
Sure.
And I think that it lands hugely for me. I have 2 daughters and a son, and it's hard being a working mom. Mm-hmm. And I mean, it's hard being a mom, period. It doesn't matter if you're working, not working, you're always working as a mom.
Right.
And I think my biggest thing is just to empower both my daughters and my son to go after everything that they want and go after it with complete passion, whatever that is. So I know we speak of women leadership, but I think in general, we need to speak of leadership, period.
Right.
Raising great men, raising great women, making sure that that we bring value and purpose to any job we take on.
It's
and
beautiful.
I don't know. So I guess it's not just for women. I think all of us need to do a better job of leading the next generation to do better than we did.
I love that. And I think that you're doing a great job of that, Kelly. And if I could say so. I don't know you that well, but I mean, I'm sure your girls and your son are proud, and I'm proud to know you. That's awesome.
Feelings mutual. For sure.
Well, what's interesting is when I was choosing the name, let's say for this podcast, right? The Sultans I love the song from Dire Straits, the Sultans of
For sure.
The Sultans of Swing. And it's just one of those things. And I was catchy, and I was actually talking to a colleague. I'm like, what about the Sultans of Spine? And so that initially was the name. And then I think I've talked about this before, but my wife was like, hey, maybe widen that lens a little bit. Like, not everybody knows spine surgery and loves it like you do. She's talking to me, and I'm like, you're my better half. You're my better 3/4. Thank you. And so we changed it to the Sultans of Sales. But I had a very dynamic and exceptional female rep who reached out to me and said, hey, I just she found it offensive because of the name Sultan, which is, I guess, has a male in her eyes connotation. And there are such things. I mean, I get that. And again, I got to be careful of my male bias or whatever you want to call that, because sure, I don't want people to think that this is just a good old boys, network.
I get that.
But, whether it's a sultaness or the fact that like a salesman, or you are a sultan, Kelly, and this gal's a sultan, and I hope she comes on the show. It's not meant to be offensive. I guess it's just like the history of the word, right? Maybe has some of that. For me,
I think it's pretty fantastic. And I don't know, from the minute I met you, I would have never thought it was like a male bias. I think you're just empowering humans in general, right? And allowing people to express how they got there, why they got there, what they're doing next. And I don't know, sometimes I think we need to lean in, but also lean out of being so extremely picky about everything that we talk about all the time.
Well, I certainly agree, and I appreciate your perspective, right? Because mine is moot. But and I don't want her to think that I'm attacking in any way. Like, I welcome criticism, right? Anytime, right? So anytime I make a speech or anytime I do anything, the best feedback is those that are like, hey, you talk too much. You talked over that guest. Some of the early podcast episodes, I cringe because it's just, I'm talking too much. In fact, one of the best, I think, things that have happened from doing this podcast and now over 50 episodes is it's such a great, it's great for me to work on my listening every single episode.
No, I think that's huge. I mean, and it's bold too, because I know I'll watch this and I'll just cringe over myself. So I am honored to be on it, but also that you will listen to yourself and you'll like almost course correct through it. We talk a lot about game tapes, especially with Prox 22. And I think that this is invaluable. When I was doing sales enablement and it was COVID, we couldn't do role playing like we usually do, right? So you would have the new hires record themselves. And I think there's a lot of value in that, is watching yourself. How do you move? How do you talk? How do you engage, right?
Absolutely.
Cringeworthy, for sure.
Yes.
But you need it.
How do you get better? I mean, look, some of the greatest athletes, and I always go back to athletics because it's been my background, and there's such parallel in sales and in life. But the greatest of the greatest would study their film and watch their game tape and then go improve and try to make it better. It doesn't matter if you're a track star, tennis, soccer, football, basketball.
Right.
Every single one of them would watch and observe kind of how they're doing things and then go practice to make it better, because I mean, that's how you improve. And I don't know.
No, I think we're aligned in that.
we're aligned in a lot of things. And I think it's just, look, you've had such a great career. What about, let's talk about your legacy. I mean, you touched on it with your children and kind of like what you stand for, your why, and kind of the being a woman in leadership that's leaving a good example. But is that, or tell me, what would you want your legacy to be?
I mean, it's all of that, really. And it's not just with my family, it's with any team or any company. I want to leave it better than I found it. And I know that sounds super simple, but it's not. And I also think, you learn by failing. I failed a lot. And so that's it. I want to learn every year, every week, every day. I want to learn something new, and I want to leave whatever that was better than when I got there. And that's really it. That's the simplest way I can put it.
I love that. I think you're well on your way. And okay, well, let's go to social media. Okay. I don't want to take up too much of your time. Again, all of these questions could be an entire episode, but we've connected certainly in that realm, whether it be LinkedIn or, just the ability to share. And Joe Mullings and I spoke about this, right? It's not one-to-one, right? When you're sharing things, it's that larger one-to-many experience. What are your thoughts? How do you use social media? Is it valuable to you?
Well, I've learned a lot from you because I am not the best at it. And to be totally transparent, I wasn't before COVID either. I like to keep my things very private.
Sure.
But with COVID, we learned that that's not always the best way. But I think that I'm still learning the nuances of how to share mindfully and not overshare, right? So that when you actually do make something as beautiful as the podcast that you do, it lands. And so I think that it's an invaluable tool if used the right way. And again, I'm learning a lot at Twitter, something I did not get into at all. And I didn't realize how many of my surgeons were actually on Twitter and what I could learn from them. And they were so open about it. Again, still new.
Sure.
And I think there's value, but I've got a lot to learn.
No, so do I. I mean, I feel I haven't mastered anything at all. I had a hunch. I needed to show up differently. And so I started posting. I definitely post too much, but I feel that it's valuable and it's returning something, right? There's, whether you look at the analytics, which are really good, or the reach and the voice. And that's where I think surgeons, and I've talked to many of them, I convinced a few of them to get on LinkedIn because that's where industry lies. And, that's, if you think about what a surgeon's doing, right? They are so skilled in their craft, and the people that know them from their training and their school and their market and their community, absolutely. But it's also competitive, and they need to differentiate themselves. And if they leave their institution or their practice for another, right? Where do those patients follow? Who do they go with? And so their ability to, they're still the surgeon, right? The surgery does not happen without them. And so I love to see, them particularly in this spine space, because there's a lot of, I don't know, it's an interesting dynamic.
Yeah. Yeah. It's such a cool tool when used the right way. I think, in these LinkedIn lives and it's just, and I think it's the future, right?
Right.
We talk about future a lot. So it's you need to get on board. You need to get educated with it.
That's right.
So I'm kind of glad I was forced to do so. But no, I'm looking for lots of teachings from you still. So
I don't know if I'm the right person.
I feel like you are.
It's humbling, honestly. It's a good way to connect. Yeah. I feel like it's a valuable piece. And again, not to make this about me, but my new company is looking for, if I can, not speak for the entire company, but we're relatively a small niche player in a market, in a niche market, in minimally invasive spine. And so how do we build awareness? How do we grow? Right. I feel obviously we got to get it in the hands of the surgeons, but what happens before then? How do we get that to that point? It's spreading awareness. It's sharing these stories. I mean, these pictures that we're seeing in the ORs, and I can't wait to, I'm getting very, very close to my first case coming soon. And I can't wait to get in there. Right. And see it and live it and taste it and then share it, because that's how this thing works.
Yeah, I think that's so special. And you do it in a really lovely way. Again, this is so out of my comfort zone. So there's something about how you interact with people and the way that you present yourself, and that made this very comfortable. So thank you.
Well, you're doing great. I mean, it sounds like you did a podcast earlier, so this is not your first one, right?
That was, I haven't seen it yet, so to be determined.
Yeah. No, you're a natural. You're gonna have your own show, the Kelli Show.
Let's not go that.
Okay, so what gets you motivated? What gets you excited?
I mean, it's stuff like this, right? It's connecting. That's it. The connectivity of just people. Mm-hmm. And I think that's a thing with Proximie too, is being able to connect surgeon to surgeon, being able to connect med device to surgeons, being able to connect med device to med device. I mean, it's just that connectivity that it's pretty incredible.
Right.
And being part of this SaaS world that I have never been a part of. I mean, I sold widgets forever. And again, they were beautiful widgets, but this is what gets me up.
I love it.
I keep saying future, which is hilarious. I don't think I would have ever, had I taken that Gallup test, I don't think it would have ever been future. And now I think it is. So maybe I should retake it.
But the thing about those tests, and it's all situational. Like, everything changes with your experience. I mean, tomorrow you might have a different outlook. That's what's so great about today, right? Like,
agreed.
We have today. That's all we need. Okay. So I feel like there's so many things, so many places we could go. And I want to, what do you, I'm going to turn this audience. So it's a little curveball. What questions do you have? What are some thoughts or some things that you may be thinking about that we can round out the discussion with?
I mean, I think it's, you and I both coming from very similar backgrounds. I mean, what would you say to somebody? You're in week 2, right?
I think so. Yeah.
And by the way, in startup world, every week is a year. So just get on board with that. 9 months in, it's 9 years.
I see your dogs in the background. It's like dog years, right?
Yeah, it is dog years. He's my office manager.
They're awesome. Mine's been like right there by the door, wagging his tail, waiting for me to open it, because he usually sits at my feet. And then my older dog, she always just kind of sleeps until it's time to exercise.
I kind of feel like I'd like to be that dog someday.
Nice life.
So I get it.
So I think,
what would you say to somebody that wants to get in, right? Like, I know how I feel 9 months in, but like, you're in that precipice of, I mean, your vice president is a huge role. Congratulations.
Thank you.
What
I would say,
I guess the serious thing is the first step, right?
Yeah.
So go.
I think it's, I'm not trying to dodge the question. I thought a lot about it, prayed a lot about it. It's just still so fresh and so new that I'm in the evaluation mode of like, how can I be the most valuable person to my team, right? To the CEO, to the board, right? And to the surgeons that we represent, right? A lot of this is going to be getting it across the value committees and the people that approve things on the hospital level. Surgeons love it. The surgeons that I've talked to, that I've shown, that have used it, that I've just, asked them questions and seen them using it, they really feel it's enabling technology. And so I feel that's exciting. And that was a big reason why I chose to join Vision. But that's not enough. In 2021, 2022, it's such a cost conscious environment, and rightfully so. Right. Healthcare is expensive, but we have to learn how to, learn how to build that value. And so getting to your question, like what I would say to people that are contemplating, looking at making a change, or, having those same questions that you and I probably had, like what's next for me? You know, I would say, ask yourself every single day, are you seeing the fruits of your labor? Right? Yeah. Are you like, that's a great point. When you work, what's the output of that? And as a spine rep, every single day you get that fulfillment, you get that quick hit, that answer. And I do miss that. I miss those days. And so for me, I think part of this is getting a little bit back to the glory and the fulfillment of being in the OR and being with surgeons and seeing kind of those high five moments where you've helped improve that surgery, hopefully that patient's experience and that outcome. Because my little kids, when I was just gone all day and I didn't see them and I missed a lot, I would come back sometimes just barely enough time to tuck them in for bed. And they said, "Dad, what'd you do today?" And I said, "We helped people. We helped 5 people today, right? 5 cases." Or that was for me something I could latch onto and that they would understand. And when I look back at all the different, career paths and decisions and forks in the road, I just want to have an impact. And so that's what I would say. I don't even know if I answered your question.
No, that is. I think that, there's a lot to unpack there, right? Your why's in there for sure. Your passion for what you do. I think it's really cool that you put your kids in there, that you could come home and say what you did, right? Yeah. Because I think that, like, you being the CEO of your family, you said it perfectly. Like, you have to weigh that out. Like, you were gone all day. Mm-hmm. What would you do that actually made it okay that you were gone all day? And I think you just said it, right?
That's right.
So, and you're teaching them. And at the core of it is, like you said, that impact, those outcomes, how you help save people's lives. And we don't get to do that a lot.
Right.
Right? We're not surgeons.
No, we're not.
So if we have any small part in that, I don't know, maybe that's like that feeling, right?
Well, and yeah, you're right. Like you wanted to get into medicine and I didn't. This thing found me, right? I was wandering and a nomad and just got back from a gap year of travel and met a girl and her cousin did this. And I just kind of, oh, okay, you wear scrubs all day and gets to work with doctors. That sounds awesome. Sign me up. Like, I was so just I didn't even know medical device existed. Right? Like, I hadn't even heard of it. And then, so I think about, like, wow, what we get to do, Kelli, like what we get to do with surgeons and like what Nadine, a surgeon CEO, those are rare. And those are incredible people. Justin Barrett with OSOVR, he's also a surgeon CEO, and you meet these people like Nadine and it's wow, because they've actually done, they're helping patients with their hands, and then they see innovation or something that could be improved for the greater good. And it's all about impact.
Yeah.
And yeah.
No, I agree.
What a life.
And what I love that you said, and it's nuances of words, right? Like, so many people are like, I have to go to work. I have to do this today. The entire time you spoke, it's, I get to do this. Look what we get to do. And that's huge.
It's a gift, Kelli. It's a gift.
Sure.
But how it is an absolute grind. And so,
oh my gosh. Yeah, right? There is no doubt about that.
That's the thing. Again,
startup world is like dog years.
There he is. Perfect timing.
There it is. Perfect. Shoe dog.
Adorable. Oh my goodness. I want to snuggle. So I'll that's what we'll close with. So for those that are looking to break in, and again, it's not a robbery, but for those that are looking to break into medical sales, be ready for what you wish for, because you're giving up, right? So much. The commitment is beyond just I can't even describe it. But it's worth it if you really, really, truly want this, right?
Agreed.
Yeah.
But like you said, you got to be ready.
You got to be
ready.
Well, this was super fun. I hope it was a great experience for you.
It was awesome. I really appreciate it and appreciate what you do for a lot of us and giving us a voice and a platform to talk. So thank you.
You're welcome. That was the whole intent of starting this podcast. I want to share the stories of others and I want to shine a light on them because there's so many amazing and unique and just incredible people that I get to, right, interact with, work with, partner with, and it's fun. It's a humbling thing that we get to kind of share this conversation. And, you know, maybe there's someone watching this that gets inspiration, that goes and does something, right? Maybe there's a little girl, right, a Lebanese girl out there that sees what you're doing, and gets inspired. And, you know, that's amazing, right?
Thank you.
So, you're welcome. Oh my gosh, this was great. Well, I'm going to close this out. Really, really enjoyed our time today. Kelli, if people wanted to learn more about you or Proximie, kind of where would you take them? Like, kind of what are some of the things we can put in the show notes, and then for the people watching today that have their pens and papers ready.
You know, check me out on LinkedIn. Look at the TED Talk from Nadine. If you haven't watched that, watch it, like run. And then obviously our website, which is proximie.com, which is so
awesome.
It's great. But yeah, just reach out to me. I'd love to talk more. I'd love to talk to anybody, whether it's about a career path or Proximie or any of it, really.
Love it. So to find you, it's Kelli Ashkouti,
Ashkouti.
Kouti.
Yep. Sullivan. Yep.
Proximie is Proximie. Okay, perfect. And thank you. God, that's awesome. I will put that in the YouTube show notes and everything like that. For sure. Thanks for carving out some time. And it's great to virtually connect again. Absolutely. I can't wait to meet you in person. Hopefully that happens soon.
Yeah, I hope so too. And congrats. Like, this company is so lucky to have you. And I can't wait to talk to you when you're a month old. So at least 4 years old.
Yeah, 4 years. Yeah.
And just keep collaborating, because I have so much to learn too. I'm a baby here. So
it's fun. And again, we get to do this, and what a gift, right? So
absolutely.
Thank you all for tuning into the Sultans of Sales featuring the great Kelli, and tune in next week.
Thanks, Jay.